Hello, I'm Tom Abinanti. I represent the 92nd Assembly District, which is Greenburgh, Mount Pleasant, and a little bit of Yonkers. And this is Assembly Update, where we talk about items of interest to our district and to Westchester County and to New York State. I have with me today David Wolllner, who is the Legislative Coordinator for the New York State Office of Mental Health. But David has some special connections to our district, our area, and has some long experience with the state, and will shed light on what's going on here in Albany and how it has an impact on us back home. David, welcome.
Well, thank you, and welcome to you, Assemblyman. It's really a privilege to be with you today. As you had said, I do have roots and ties to your district. In fact, I worked with your predecessor when Assemblyman Brodsky first arrived in Albany back in the early 80s, and have stayed in Albany now for many years. But as you mentioned, I grew up in Hartsdale and was educated in the Greenburgh Central 7 School District, had a wonderful educational experience there. My parents, in fact, still live in Hartsdale, and I have family in other parts of Westchester County as well.
So we will make sure that when this airs, that everybody in that part of Hartsdale knows to watch David, who's a local boy who did well and made good.
Sure.
Now, you've been with the state for how long?
I've been with the state for about 30 years. I've also worked at the local level and at the county level, but I've been in state government for now about 30 years.
And we go back, you were telling me that you were an intern with Lois Bronze?
I owe much of my early start in government, and my appreciation really is with Lois Bronze, who at that time was a town board member, and I was a senior in Woodlands High School in 1977, a long time ago, and had this wonderful opportunity through the WISE program, which was a senior year experience where students could intern, apprentice in occupations and professions, vocations that were of interest to them. At that time, I was very interested in local government and had an opportunity to work with Lois as a town board member. Had a wonderful experience working with her on a number of interesting projects dealing with recreational activities, working on senior citizen issues. We developed a senior citizens handbook. This is long before, obviously, the internet, so everything was, on paper. But it was a wonderful start, and really gave me a wonderful experience in terms of how government can serve and help people. And Lois was terrific to work with.
Lois and I served together on the town board for 6 years. I was a town board member 80 to 84, and then again 90 to 92. And then I was elected to the Board of Legislators in Westchester, started serving on January 1, 1992. But I worked with Lois for a long time. Great woman. She's revered in the community with good reason. But her concern for young people and bringing them in is so appropriate. I've done some teaching, a little bit of adjunct teaching, and I am frankly appalled at how little our young people know about our government and how everything works. And we really need more programs like that. And look, it gave you a career. It got you started in a successful career that is beneficial to you and beneficial to our whole community. And we really need to do more of that. We really need to get kids involved. I'm concerned that the attitudes that people have towards government today are rubbing off on kids. And they don't have respect for government, and they don't have an understanding of government. They don't understand the need for government. And I think it's just going to make our society worse, not better.
I agree. It was a wonderful experience. I owe a tremendous amount not only to Lois Bronze in her role as a town board member, but to Vic Leviathan, Jill Gluckson, who were longtime coordinators of this WISE program. I know that the program has not only gone statewide over now many years, but has spread across other states, and the Board of Regents have supported the WISE program. It's a terrific program. Lots of my friends ended up in careers after those kinds of internships. So it was a very successful experience. I went on to have some wonderful work experiences, summer work experiences with the town. I really started actually in middle school, early high school, working for the Greenburgh Central 7 School District in a federally funded program known back then as the CETA program, which provided funding to localities to hire kids to work in the summer, and I actually started out by helping to paint school buildings at the old Tarrytown Road School, at the Richard J. Bailey School in probably 8th or 9th grade, and it was a great experience. And then I went on to work for the town probably for another 5 or 6 summers at the Greenburgh Town Park, working as a camp counselor, later on at the town park as a pool attendant, and it was a great experience.
You know, today one of our biggest problems is that young people can't find something productive to do. Right. I have kids who are coming out of college who are calling my office and saying, we want to work in government. Is there any way you can help us find a job or give us a job? And at the same time, as I saw as a county legislator, the jobs that used to go to kids are now going to adults. Whereas kids used to be operators of the rides at Playland. We now have adults doing that because they can't find other jobs. The job market is terrible, and it's having a major impact on kids who really need to get started with gainful employment and also something that gives them some understanding of life, a real responsible job. And whether that's collecting money at Playland, whether it's working in a government office or even in a business office, we're just not doing that. We're not getting kids started. But let me ask you a question. What are you doing now? You're with the New York State Office of Mental Health.
Yes, I'm with the State Office of Mental Health, and my specific role and responsibilities are to serve as the legislative liaison to the legislature. So I spend a lot of my time talking with legislators about issues in their district that relate to mental health and other health-related issues. I spend a lot of time also promoting our legislative program. The Office of Mental Health, like other state agencies, has legislative interests that relate to amending the mental hygiene law or addressing issues that come up during the course of a legislative session.
Well, let me ask you a question.
Sure.
Why do we have a mental health office? Why do we have a mental health department?
It's a great question. The Office of Mental Health primarily has the role and responsibility of providing public mental health services, and that means on an annual basis we provide services to almost 700,000 New Yorkers across the state by means of providing inpatient, outpatient services to adults, children, and adolescents. We also support a forensic system, and there are 2 state-operated research institutes, one located on the campus of Rockland Psychiatric Center, not too far from your district, known as the Nathan Klein Institute, and another institute that does state-of-the-art research in Manhattan, the New York State Psychiatric Institute. But our role, in addition to providing direct services to New Yorkers, is also to oversee, to regulate, to license, to survey, to inspect providers across the state as it relates to
now we have in New York a rather complicated system of providers, right? We have direct provision of services from the state,
yes, from
the county. Do any local governments provide mental health services?
Yes.
Who would that be? New York City?
New York City has an extensive array of services. There are other localities across the state that do as well, but particularly New York City.
Okay. So, and then we also have for-profit and not-for-profit providers, right?
Yes.
And for example, we were talking before about Westchester Medical Center has an inpatient service.
Yes.
I don't know, do they still provide outpatient services there? I don't recall. I don't think they do.
I do not know if they currently do.
But we have a lot of outpatient services in Westchester.
Yes.
Right? We have the county provides some, the state provides some, and we have not-for-profits.
And you also have proprietary for-profit psychiatric programs and hospitals. For instance, Four Winds in Cantona is a for-profit.
I know this is a big point of discussion right now with the Westchester County government. I just left there as a county legislator, and one of the discussions was whether the county should continue to support outpatient services, or we should just get out of it completely and turn it over to not-for-profits. The county executive said we should get out of the business completely. The Board of Legislators said we need a transition period to see if this is in fact a reasonable alternative. Can the county back away from the service? Does the state have a lot of facilities in Westchester County?
We do not operate any inpatient or outpatient facilities that are state-operated in Westchester County. The closest state-operated facility would be Rockland Children's Psychiatric Center.
What about outpatients?
We, again, certify, license, oversee a number of outpatient programs,
So in
but we do not have.
So in Westchester County, then, if Westchester government pulls out of it completely, then there are no government-operated services outpatient in Westchester County. It would be all either not-for-profit or for-profit.
Yes, that would be so, and there would be obviously private practitioners as well. But yes, there would not be. There are not currently state-operated programs that I'm aware of in Westchester County.
Now, we're dealing. Your population that you deal with goes from, I guess, the people we see walking the streets, the homeless, to people who are having difficulties in their marriages. To is that? I mean.
Sure. I mean, 1 in 4 Americans are affected by mental illness. So it's obviously a significant number of individuals, adults, children, adolescents, who at some time in their lives experience a mental health issue or problem.
I think a lot of people think of mental illness as a permanent condition.
Well, that may have been the prevailing attitude, and that still may be for a lot of folks. But the truth is that folks go on to recover by way of treatment and care, and are able to live, very full and productive lives, and have productive careers, and raise, families, and go on to do all sorts of, exciting things. So, no, there are today, all sorts of programs, whether they be support programs, obviously treatment care programs, family support programs, that provide lots of opportunities for recovery from mental illness.
Let me ask the question that I hear from so many people all of the time. What do we need government involved in this for? Why don't you just let people out there, you got doctors, let them handle the service. Why do we regulate them? Why do we license them? Why should we do any of this?
Well, I think that's a good question, and particularly when the state is facing a significant fiscal crisis, those kinds of questions have to be asked as to how the state, what role should the state have, and should the state be as involved as it has, to the state. The response is the state has a responsibility, certainly as it relates to quality of care, as it relates to ensuring that the programs, since there are governmental funds, taxpayer dollars being used to support many of these programs, government has certainly a role to ensure that these programs are accountable, are being provided in a quality manner, that there is oversight, that these programs are inspected by the state to ensure that they are in compliance with state regulations and protocols and policies. So I think the state, clearly has a role, and I do think that the citizens of New York expect to see the state have and continue to have a role.
Is there any place that someone who needs mental health services can go and get a list of the types of services that are available, and find out if they're appropriate for their needs or the needs of a loved one? Sure,
that's a great question, Simon. We have a very extensive array of programs and services here in New York State, and we're very fortunate. The best place to go probably is the OMH website, which is www.omh.nys.gov. And
can you say that again?
Sure, www.omh.
That's like Office of Mental Health,
yes,
OMH.
Yes, Office of Mental Health, NYS.gov. And on that website, on the home page, there is a very user-friendly site that allows an individual, there's a map of New York State color-coded by county that will allow you to see where the programs and services are in your respective locality.
It's nice to see you again. I think you've been very informative and very helpful. I very much appreciate your coming on and joining us and informing our citizens of what the Office of Mental Health does. And I personally think it's a very important service to the people of the state. And I thank you for your years of dedication, because it takes people like you who have an understanding of our community, an understanding of our services, to put this all together so it works for the people of New York.
Thank you. It's been a privilege.
Thank you. Thanks very much.
Thank you.